For the introduction, anemia is a medical condition in which the body lacks enough healthy red blood cells to carry adequate oxygen to the tissues. This disorder has symptoms and breaks and can be caused by various factors. Anemia is typically diagnosed with blood tests and can be treated depending on the underlying cause, such as with iron supplements and medical treatments. The study of aplastic anemia was chosen because it is a problematic diagnosis and has a very complicated and advanced treatment. The biological system involved in aplastic anemia affects the hematopoietic system. Impaired bone marrow function has systemic effects on the circulatory system and immune response. This interaction increases the risk of infection, fatigue, and bleeding, while emphasizing the complexity in the management of aplastic anemia. Treatment for aplastic anemia requires a combination of supportive care and long-term monitoring to ensure better patient outcome.
Overview of anemia. Anemia can be classified into several types based on its cause or the nature of the problem affecting red blood cell. First is iron deficiency anemia. Iron deficiency anemia caused by a lack of iron, which is essential for hemoglobin production. Second is aplastic anemia, is a condition where the bone marrow fails to produce adequate red blood cell. Third is hemorrhagic anemia, that caused by the premature destruction of red blood cell due to inherited condition or autoimmune reaction. Fourth is sickle cell anemia, which is red blood cell become sickle-shaped when the oxygen concentration is low. Last but not least is pernicious anemia that result from the lack of vitamin like vitamin B12, which are needed for red blood cell production and maturation. Causes and symptoms of anemia. Anemia can be caused by destruction of red blood cell, decreased red blood cell production, and blood loss. First, red blood cell destruction can cause intrinsic and extrinsic hemolysis. Intrinsic hemolysis is under genetic condition that causes sickle-shaped red blood cell which shorten their lifespan and destroy prematurely. Extrinsic hemolysis is an autoimmune disorder or infection by immune system or pathogen. Second, the decrease in red blood cell production that causes bone marrow failure. It starts with the damage to the hematopoietic stem cell and leads to insufficient erythrocyte. This also causes nutrition deficiency like vitamin B12, iron, and folic acid that affect the red blood cell maturation and synthesis of hemoglobin. It also can lead to chronic disease due to the lack of erythropoietin production that can cause chronic inflammation and kidney damage. Lastly, blood loss can cause acute or chronic bleeding, lead to a reduce of red blood cell count. Symptom of anemia: increased heart rate, fatigue, pale skin, and dizziness.
For patient profile, the name is Laura Chapman. The age is 32 years old, the gender is female, and the occupation is school teacher. Her medical history is, before the onset of symptoms, there is no significant medical issues. There are no history of bone marrow disease in the family and previous episode of med infection treated with antibiotics. For the presenting symptom, there is extreme fatigue and weakness over 3 months. Secondly, easy bruising and bleeding. Thirdly, increased susceptibility to infection with a severe attack 2 months ago. For the timeline of disease progression, there is symptom begin subtly with fatigue, progress to significant bruising and recurrent infection. Secondly is diagnosis with aplastic anemia after blood test show pancytopenia.
Assalamualaikum warahmatullahi wabarakatuh. My name is Alia Balkis and I am going to explain 2 parts, which is diagnosis and also treatment plan for the patient Laura Chapman. Okay, to diagnose Laura Chapman, we start by reviewing her medical history. We look for symptoms such as fatigue, frequent bruises, bleeding, and also recurrent infection. We also consider her family history and any possible exposure to toxin because this will contribute to her illness. Next, during her physical exam, we noticed she had pale skin, which can indicate to anemia, bruises, and possible signs of infection, which are common to patients like this. To confirm our suspicions, we ordered 2 laboratory tests. Firstly, CBC, which is a complete blood count. This will reveal significantly low level of red blood cell, white blood cell, and also platelet. Secondly, a bone marrow biopsy. This confirmed the diagnosis by showing a reduction in bone marrow activity. Finally, additional tests such as viral study and also screening for autoimmune or genetic cause were performed to rule out other conditions that could mimic aplastic anemia. Treatment plan for Laura Chapman. After diagnosis, we prioritize immediate supportive care to stabilize Laura. Blood transfusion were given regularly to manage her low red blood cell counts and also platelet counts. This helped prevent complications such as severe anemia and also excessive bleeding. To address the root cause of her condition, we start immunosuppressive therapy. This includes combination of antithymocyte globulin, which is ATG, and also cyclosporine. This medication work to suppress her immune system and stop it from attacking her bone marrow. Because Laura's white blood cell counts was critically low, she was at high risk for infection. So she was prescribed antibiotics and also antivirals to reduce her vulnerability and also to keep her safe. Lastly, we focus on monitoring her recovery. Her blood counts were checked regularly to adjust her treatment, and also her bone marrow health was periodically evaluated to track her progress. That's all.
For the discussion part, this patient with aplastic anemia faced a multitude of problems, both physical and emotional. Fatigue and recurrent infections are most dominating features in their life struggles, while the risk of bleeding or even the development of secondary malignancies as a result of protected treatments makes the battle even more daunting. But fascinating is how modern medicine has transformed the outlook for those patients. For example, nowadays immunosuppressive therapies are most cornerstone in managing overactive immunity, and bone marrow transplantation provide hope for restoration. That is how science keeps on giving hope even in most complex cases. And for conclusion, aplastic anemia is not a disease but a sign of how interconnected the system of the body are. The early diagnosis and comprehensive treatment plans will afford the patients the best chance of recovery. It is in knowing the cause of the disease and its ripple within the body that allows us as caregivers to give a better care. Excitingly, it is an oncoming research ushering in new innovative solutions that is turning the challenges into breakthrough. The area is really a true example of the spirit of progress within medicine. Thank you.